Okay, welcome everyone. Welcome to today's webinar presented by the Alumni Association. Today we're going to be talking about keeping your pets happy and healthy during this COVID-19 time period. And I wanted to start today. My name is Brittany Jameson. I'm the Director of Minnesota Engagement here at the Alumni Association. And I wanted to thank you for taking a couple of minutes with us over the noon hour on a Friday to talk about our pets and keep them happy and healthy. But also I want to thank you for taking the time just to spend some time with us in the midst of this chaos and crisis. Hopefully this is not going to be a really intense seminar. We're not going to be getting into like some nitty-gritties of epidemiology or doom and gloom. What we're going to focus on instead is how we can keep some of the most important members of our families as happy and healthy as we're trying to keep ourselves. So we have the amazing Dr. Kristi Flynn with us today from the Vet Med Center, and she'll be sharing all of her tips and tricks. But at any point, if you have questions, as I mentioned before, on the right-hand side of your screen, or maybe the panel at the bottom, depending on kind of what your view looks like, there's a Q&A box. That's a great place to put your questions as we go. At the end, we're gonna leave plenty of time for Dr. Flynn to answer those questions. So you can type those right away there. If you also are having any technical issues, if you're having trouble hearing the audio or getting your screen to share, some things work a little wonky, I can answer some of those in the chat that way. All right, so let's get started. First and foremost, I just want to give a shout out to our Alumni Association members. Our Alumni Association members and donors make initiatives like this possible for you all. If you're interested in learning more about the Alumni Association or becoming a member and helping support, you can visit umnalumni.org for more information. We have a really exciting and diverse panel of webinars that are being hosted right now. Since we're all at home, we've been shifting to a more virtual engagement model. And what that means is that we're tackling a lot of different issues that people might find during self-isolation or self-quarantine times, and also things that are applicable outside of that as well. So on your screen, you can see a few that we have coming up. If you have any questions about these or want to get involved, register for them, you can visit umnalumni.org/virtual. And I'll just give a shout out. The presenter who's doing the April 13th one of Caring in Uncertain Times for helping adult children with aging parents find support. I've seen a little bit of the content and it looks like it's going to be a really incredible presentation. So I hope you can join us if any of these are of interest to you. Additionally, as I mentioned before, if you would like to use Zoom to hear some phone audio, maybe you want to have the audio a little bit closer, you want to connect to some headphones, a great way to do that is to use our dial-in option. Or if the audio is cutting out at any point, this is an option. So you dial the number on the screen and then you enter that webinar ID below. This one-click option is also available in the email you received today. So those are some options if you're needing some help with the audio. We will also be sending all of the slides and a full video presentation of all of the information presented today, along with a few resources in that post-webinar email. So that will go to everyone who registered. So take a look at that. I know a lot of times it's helpful to have the slides to refer back to, and also there will be a handful of resources that Dr. Flynn will be mentioning that can be really helpful in that process there. I'll give one last shout out for it because it's always one of those helpful things to look at is that question box on the side is the place where you submit questions. We have a little picture of it on the screen. It has that Q&A and a little Q in the box. So that's where we can start. Okay, so let me just jump right in here. Today, our presentation is going to be put on by Dr. Kristi Flynn. Dr. Flynn is a graduate of the University of Minnesota College of Veterinary Medicine, and she primarily cares for dogs, cats, and their families at the Vet Med Center. She's passionate about preventative care, behavior, including the implementation of low stress handling techniques in the clinic, veterinary dentistry, nutrition management, and the prevention of obesity. All stuff, to a certain extent, we're going to talk about today. And Dr. Flynn also works with students, so that provides her an opportunity to share her enthusiasm for these important topics, as well as learn something new every day. All right, Kristi, take it away.
Right. Thanks, Brittany. You've done a great job. I appreciate all of your help. So like she said, I am Dr. Kristi Flynn. I work in the primary care department, and I've had the pleasure of working at the Veterinary Medical Center for the last 9 years. Prior to that, I worked at a small animal private practice in South Minneapolis. And in the primary care center at the Veterinary Medical Center, we're sort of trying to prepare students for kind of that routine care that many of them will be doing after they graduate. And so we're trying to kind of mimic that in a very busy tertiary care facility. But again, yeah, like the bio said, working with students is just one of the highlights of my job, and that's something that I'm really missing, not having them in the clinic or on campus right now. So yes, we're going to cover some different topics today, trying to keep our pets happy and healthy during this COVID pandemic. So we'll go over what the governor's executive orders kind of mean for veterinary medicine and how that applies to you and your pets during this time. My soapbox topics whenever I get a chance, but these things are always important, of course, but even more so kind of during this time, we might have an opportunity to kind of tackle some things or make sure we're being preventative as far as weight management, keeping our pets occupied and entertained during this new, model of everybody being at home all the time, kind of what those social distancing walks mean and how that might be something that would be beneficial to keep up long-term, as well as kind of what we should be thinking about now in preparation for making sure that the transition back to more normal work and leaving the home and all that, how we're going to make sure our pets can make that transition from us being home 24/7 for weeks at a time to kind of getting back to being alone. We don't want that to be stressful or hard for them. It'll be stressful and hard for all of us too. It's been great to be with them all the time, of course. So the governor's executive orders impact veterinary care, as well as, there's mandates that pertain to both veterinarians as well as physicians. And it's kind of mandating some of the changes in the ways that we are practicing during this pandemic, which includes limitation on procedures. So veterinarians are mandated not to do just elective surgeries such as spays, neuters, routine prophylactic dental care. So kind of all those things that we think are really important, and we want to be able to provide that care for your pets. Right now, we want to focus on the safety of our staff, for our clients, the greater community. So we're limiting contact by not doing those elective procedures, in addition to preserving PPE for the human side during this pandemic. So things even just like where normally, if a dog tears their cruciate ligament, that would be something that we would, want to maybe perform surgery depending. That during this time, that's also an elective procedure. And so we're not doing a lot of those kind of things. If your pet were to have a broken leg or, something life-threatening, those surgeries can still absolutely be done. And so, as you're kind of thinking about it, or if you're called your vet and they're like, no, we're going to wait on that. The things that we still think obviously should come in are emergencies. So if your pet, was hit by a car, or if they're having trouble breathing, or, not able to urinate, any of those kind of obvious, like this is an emergency, your pet needs to be seen. We're still open. Other veterinary clinics are still seeing our emergencies to make sure that your pets, are getting the care that's very essential that they need. We're also seeing, so normally on our primary care service, we're seeing a lot of preventative care, of course, so vaccinations and kind of things like that. Well, we're still continuing to see like ear infections, because that's painful. And if we don't see that, it could continue to progress and become more problematic for the pet, or urinary tract infections, or the 2 dogs in the house, got into a fight and someone was bitten. So just all those kind of things that would still fit what should be seen by an urgent care doctor. So we're kind of focusing on that kind of care at this time. So what about preventative care? So like something I think is just so essential and so important. It's been really hard to kind of recognize that this is a very different time, and that those things, hopefully having been really good about all of that up to now, makes it so that we can, be judicious during this time and try to minimize, again, contact with each other and put the greater good of the community first and foremost. So the vaccinations that we're still doing during this time include puppy and kitten series, because if we don't give a puppy its parvo vaccination right now, and then you're out on walks and they get exposed to it, then that could be an emergency and a very expensive, challenging thing to kind of treat and support them through. So no question, we're still seeing our puppies and kittens to kind of make sure that we're getting all of those things done in a timely fashion to protect them. As far as rabies vaccinations go, it's a gray area, and we've contacted our board of veterinary medicine a couple of different times to try to kind of get it kind of nailed down. And I think they're being smart and being kind of allowing it to be a gray area so that different practitioners can kind of practice within what they're most comfortable with. For the Veterinary Medical Center at this time, we've decided that we're going to do the initial rabies, of course, for our puppies and kittens, and then they get a 1-year booster. That's the typical recommendation, and then we follow a 3-year protocol after that. So if a pet is due for that 1-year rabies vaccine, we're doing it. Beyond that, we are just saying these pets are unlikely to get exposed to a rabid animal during this time. The vaccinations probably provide immunity for a longer duration. So while the shelter in place is in effect, our stay at home is in effect. We're not seeing those ones that are due for 3-year rabies vaccines during this time. Again, different veterinarians might be practicing differently, but we hope to be able to update them within a month or two, and certainly we don't think that should be a big problem. And then we are really fortunate to see a lot of working canines. And of course, when your job is to potentially have to bite somebody, then those guys, we're definitely keeping them current on their rabies vaccines as well. And then preventative medications. Normally, a veterinary client-patient relationship is when I have personally met you and your pet. I've put hands on your pet and done a physical exam, and we've discussed concerns and sort of have established a medical rapport and relationship. That normally is 1 year per our board. During this time, they've extended the veterinary client-patient relationship to be 18 months, which means that I can continue to prescribe preventative medication. So if I've seen you in the last 18 months with you and your pet, I can get you, months of heartworm preventative to get you through, and then we can come back once the stay-at-home order has been lifted or loosened, and we can come in and get the heartworm tests and stuff. I certainly don't want your pet to, not have preventative medications. And, everything, we'll have to see kind of how everything is different. It's impossible to make black and white rules about how we're doing this. So if the pet needs a pain medication or ear cleaner, or all these things are just kind of interesting and unique challenges to just really make sure that we're meeting every pet and client's needs as best as possible during this time without having to have you come into the clinic. So when we do need to see pets for the urgent clinic, urgently, how a lot of clinics, and ours certainly is handling that, is you drive into the parking lot, we bring your pet technician in PPE that they continue to use different times, different shifts, so they have cloth masks that they're washing and everything. They come out and grab the pet from the car, bring the pet in, and then I see the pet, call you on the phone, and we come up with a plan and go over everything. So it adds challenges, and then of course stress to the pets when the owner doesn't come in and some stranger with a mask on. This is all very weird for them. So again, kind of minimizing that. The Board of Veterinary Medicine, normally we hadn't had a telemedicine sort of the ability within our licensing, but now they're making that so that that's something we can do. And again, we still need to have that valid veterinary client-patient relationship. Having actually put hands on your pet, we can't establish a relationship through telemedicine. But maybe we can, yes, indeed, your dog is limping. Can you do this or that? And kind of try to work things through telemedicine if possible. So a soapbox, one of my, I think, one of the most important things. So the Association for Pet Obesity Prevention, currently they, through veterinary visits annually, they take a week and we assess pets. And currently in the United States, we believe 60% of cats and 56% of dogs are obese. And so while that means that half of you guys, us on this webinar today, our pets are overweight or obese, That means that we might have a chance to kind of tackle that or kind of hone in on it a little bit while we're going through this. So if you're, your veterinarian, if you wanted to call them during this to kind of ask them about a weight loss plan, that would probably be something they could still do over the phone. But kind of the main thing is just always maintaining that balance between the calories that come in and the energy that's expended. And so for some of us, we're suddenly being able to go on a lot more walks than we used to. So maybe we have to actually bump up the calories a little bit. For others of us, we're sitting here working at the computer all day. Our pet is relaxing next to us, and they look up at us with those beautiful soft eyes, and we find ourselves giving them a little bit of our snack. So they might be at risk of gaining weight, or maybe for some of us, we're doing both, and they're just going to end up being just right at the same place. But I think as we kind of get into the next couple of areas, it's important to remember that treats really should only make up about 5% or less of their daily intake. Otherwise, it actually alters the kind of their overall nutritional. They can end up with deficits of certain vitamins and minerals and things that are complete imbalance in their food. So we want to make sure and keep that in mind. But this is kind of something that we go over with our clients and puppies and kittens, just to kind of help. This is a really great way to kind of figure out if your pet is at the right weight or if they're a little underweight or overweight. And it's a great way because we don't need a scale. If you happen to have a German Shepherd and you are trying to lift your German Shepherd on the scale and then subtract, a little bit challenging. So this is a way that we can really just feel without necessarily needing to go anywhere to use a big scale. Or if you have a little tiny dog and you're trying to get it to stay still on the scale, whatever. So how this works is if you make a fist and you run your fingers over the top of your knuckles, if it feels like that, if your pet's ribs, by feeling their side, feels like that, that means that your pet is too thin. If you flip your hand and you're sitting like this and you're rubbing right over where your knuckles are, that padded area, and you can kind of feel your bones, but it's kind of hard, that means that the pet is too heavy. The sweet spot, the perfect spot, is by taking your flat hand, running your fingers over your knuckles. So they aren't sticking out, but you can feel them easily. There's a little layer there to kind of move, but that's the ideal body condition score. And it's a way that you can keep an eye on things without even having a scale. This handout was put together by our veterinary nutritionist, Dr. Julie Churchill, in the nutrition service at the Veterinary Medical Center. It'll be included in your webinar email, but I think it's just a great kind of just reminder about keeping our pets fit now, but always. And so, as we're trying to do webinars or work meetings or those kind of things, we need to keep our pets kind of out of our work area. They're distracting. I know from times when they, scratch the door or come in when I'm trying to teach a class now through the Zoom format, that it's been a little bit tricky every now and then when something's going on with them. So kind of strategies to kind of help keep them occupied. I think if we just can, possibly with our cat, maybe we know we have something coming up at 11:30. So for 15 minutes before that, getting out the toy with, like the string with the feather on the end or whatever it is your cat really likes, play with them for 5-10 minutes, get them tired out so they might be ready for a nap. I think rotating toys out for cats, so everything kind of seems more novel and interesting if it hasn't been out constantly. So put much of the stuff away, bring something out, have it out for a week, and then put that away. Kind of rotating through to kind of keep things interesting so they can stay occupied, or we can kind of tire them out. Teaching a new trick. So all these great walks are awesome, but then their stamina kind of builds up. So then it takes a longer walk each time, to kind of help tire them out. So sometimes mentally tiring them. There's some great websites. We recommend anything. I usually use a clicker when I'm doing trick training. It's kind of how dolphin trainers and stuff are able to get those animals to do really complex behaviors. And so there's information out there, of course, about that. But even if you're just, watch some videos about how to lure a dog into a position or something with a treat, and then eventually you kind of transfer it over so that they're doing it for the reward. It also is, mentally tiring, but it also is fun to kind of build those relationships with your pet, see how smart they are. Old dogs can learn new tricks, and I hope to kind of come out of this with a couple of new tricks with my dog up my sleeve. And then I like hiding kibble around the house. So maybe for your dog or cat, if you have both, we know dogs will probably push the cat out of the way. So maybe lock somebody up so the other one can do it. But if you kind of hide little caches of food kind of around and then let the cat or dog go and look for that, that can be really fun for them. It kind of mimics what they would do if they were out on their own. And it kind of serves that need. It kind of tires their mind as well as kind of gives them something to eat. My own dogs, I'll take a handful of kibble and just go throw it out in the grass and watch them forage around and kind of try to get that. So it's using their nose and all their senses that are so important to them, and it can kind of end up tiring them out a little bit afterwards. And then I'm a big fan of using my dog food. So I just have canned dog food. There are ways of like making it so that you can use your dry kibble and plug the end of the little Kong toy with a little bit of cheese, and then fill it with water and tip it, keep the Kong upright and put it in the freezer in a cup or something to kind of, you can use dry food that way. Again, I just fill up the canned food. So they run the Kongs through the dishwasher and then fill them all up at one time with a can, put it in the freezer. And then I have it easy, ready when I need to do something. I grab that Kong out. My dogs all know that means this is kennel time. They go running to their kennel. They can't wait for me to get out of their hair so they can work on their Kong. And then after they've eaten, a little nap always feels like it's inevitable. They're going to feel like resting after they've eaten a little snack. I have small dogs, so the smaller Kongs, but the nice thing is I can make sure it's complete and balanced, so it's their dog food, and I can know okay, today was a busy day. They had 3 Kongs. This is how much less kibble I have to give them. So it's a good way of kind of managing their calories while giving them something to do and keeping them occupied. There are a lot of other really cool puzzle toys, some of them that require us to be there to interact, but there's just infinite options out there. And as long as you're just some of them you have to monitor more carefully to make sure that dogs don't bite a piece or swallow or anything like that. But there's a lot of great options to kind of help keep them entertained while we're in this new world of giving presentations online with the animals just right outside the door. And children for some of us too. And so if I could have any one thing come out of this for our dogs that we would kind of maintain, it would be this. So keeping more than 6 feet. All dogs just really don't want to meet all other dogs. And it's not until you've had a dog that gets nervous and scared and doesn't want to meet other dogs or barks at them or something, I recognize there are dogs out there that are social butterflies, just like people. And for dogs, we'll kind of get into the puppy thing a little bit later here, but there is a really specific socialization period. During that time, we want to make sure they have all positive experiences, but they are kind of open to meeting other dogs. So it's kind of like when we're in our 20s. Then by the time you get to be in your 40s, you're an adult dog and you maybe have your group of friends and you're glad to meet some other friends, but you're not kind of that same, really wanting to kind of meet a bunch of people. So if we could give everybody their space, dogs their space, I think it really could lead to better, more behaved, more comfortable dogs just out in society and out in public. And then, it could also lead to a reduction in bites. I mean, how many times are children, encouraged to maybe pet a dog and the owner just had no idea that their dog was actually showing stress signals. So Lily Chin is a illustrator who has these really great illustrations on looking at dog body language. So some of us just have never, been educated on what signs of stress and anxiety look like in dogs and maybe just don't even know. And so we can add a link to that as well so that we can kind of find some of her illustrations, make it easy for you. But if we can actually reduce bites by maintaining the 6 foot as our new norm, that would be ideal in my book. Here's 2 links that will be included in the email. This European dog article in the Bark is one that I really like. It basically says that we should just all be ignoring other people's dogs, which I know as a dog lover and as somebody who gets to work with other people's animals every day, I know that sounds kind of weird. But basically, it sort of implies that their dogs are better behaved because if I'm out in public and your dog comes rushing up to me and I scratch their ears and get them all excited and give them some treats, that's reinforcing. So the next time they see somebody, they're going to be dragging their owner at the end of the leash, trying to introduce themselves, maybe not in the most polite, desirable way. If instead they have never been reinforced for that and everyone ignores them, it's going to be a lot easier for the owner to kind of keep their dog contained into themselves. So it's kind of a interesting take on kind of our culture and how we interact with dogs. And I think if we, kind of think that more like elevator behavior, so we don't go into the elevator and introduce ourselves to everybody there. If we could sort of have that kind of mindset for our dogs where they could just kind of be near each other and ignoring each other, it might just make everybody's life a lot easier. And then this Dog Park is Bad actually just covers some really cool kind of interesting points about socialization period, kind of rude and bully behavior that maybe occurs at dog parks. And I think certainly during this pandemic, I get that we want to go to the dog park and, get the exercise and get our dog's energy out. But again, trying to kind of minimize contact with others being really important. And then in addition, if a bite or something occurs, now you have to go to the vet during this time when we're trying to minimize contact. So maybe now isn't the time to kind of look at that. And this is a kind of a great article that kind of illustrates some of the concerns about dog parks in general that a lot of us wouldn't necessarily know about. And then just in general, keeping the future in mind. So we've been seeing, quite a few puppies during this because they are the ones that still continue to get, need their vaccination series and those kind of things. So we've been seeing a lot of puppies still, and this is a really challenging time for socialization. But Dana, our behavior technician, who is a very skilled trainer, she's put together a pamphlet that we're going to share with you as well on how to socialize puppies during this time. Kind of to my soapbox again, but I know a lot of people are worried about, these puppies aren't going to turn out social, but I'm wondering if maybe lack of negative experiences that were inadvertent or we maybe didn't recognize were negative. I wonder, it'll be kind of interesting to see if maybe they actually turn out better as a result. But really important kind of socialization tips still that, we want to expose your puppy to different sounds. That's something you can do, just Googling sirens and fireworks and things like that on the internet, and then just making sure that it's like not so loud that your puppy's like ears are going down or they're getting nervous. You give them some treats and they can kind of hear those kind of noises, and we can get them used to some of that stuff. You might have a chance to recreate the vet office. So the dryer, put a mat on the dryer, put the puppy up on the dryer, have them eat some treats while you're manipulating their hands and kind of looking in their ears. So you can kind of do some of those kind of things. Even just sitting outside with your puppy on a leash in the front yard as people are walking by and kids are going by on bikes and all of those things, we still have an opportunity to socialize them. And like I said, maybe in a more controlled, less scary way might end up being better for those puppies. Who knows? I think about the fact that starting now as we mean to go on. So again, if our dog's with us 24/7 for weeks at a time, it's going to be more challenging to kind of shift gears and go back to work all of a sudden. They're going to notice our absence and feel it like we'll feel theirs, of course. But for that reason, I think it's important, like I had mentioned earlier with the Kongs, for my dogs, they are used to getting their meals in kennels, and that's where they usually stay when I'm gone. So it's easy for me to kind of find a minute or two, like now, and tell them, time to go in your kennels, and have them eat their Kongs and that kind of thing when I, and then can close that door and come out and do other things. If your pet normally hangs out in one bedroom while you're gone, putting them in that bedroom and just kind of going about your business for a while, so that they just kind of get used, that stays part of their routine. It doesn't have to be the 8 hours that you'd normally be gone at work. Even just like an hour, a couple of times a day can just kind of be helpful. If your dog's used to leaving them loose in the whole house because they're well behaved and trustworthy, maybe you, as much as we want to go on walks with them, maybe you take that opportunity just to go out and walk around or do something in your yard for half an hour while they're kind of loose in the house, so that it's not going to be such a harsh transition when we suddenly go back and then all of a sudden we have separation anxiety or those kind of things. And one of the big things I think about preventing that just in general is I always try to kind of ignore my dogs for about 10 minutes before I leave. I mean, not like actively ignoring, but just kind of going about my business of getting things ready. And then, like I said, my dogs, they've been going in the kennel since they were puppies. That's just kind of something we start with. And I go to the freezer and they all just rush their kennels and they're like, see ya, get out of here. They can't wait for me to leave. give them their cons. And then when it's time, when I return, everybody's excited. I'm excited to see them. But instead of like getting really, animated and excited to see them, I try to like basically open the kennel doors, ignore them, quietly take them outside, just let them go about their business. When I come back in about 10 minutes later, then I might kind of sit down and do those greetings, because I don't want it to be so distinct that when I'm here, all the good things are happening, including attention. And then when I'm back, when I'm gone, nothing good is happening, and and then I come back and everything good is happening again. I almost want it to be the opposite, where nothing good is happening. Now I'm leaving and this great thing is happening. And then I come back and it's like no big deal again. So that's kind of how I try to prevent that. And again, that is structured quiet time when, if you're still home and working and you're kind of just practicing that a little bit, I think is a smart way to prep them for the future. So again, this is the handout that'll be included. It just kind of has some really great ideas. And while some of them, it's geared towards puppies, these are still things that you can do with your adult dog. So it talks about like going over new surfaces and just things that might be interesting and fun for your dog when you have maybe a little more time on your hands. Maybe you don't. I know it's challenging to try to manage everything being at home, instead of kind of compartmentalizing and being able to be really on for each of those separate areas. But it just has some kind of cool ideas about walking over different things, and could be useful for your adult dogs as well. Or if you have a friend or family member that's thinking about getting a puppy, because I totally get the draw, like you have time right now, this will have some good ideas for them as well. So I know that was kind of brief. I wanted to make sure we had plenty of time for questions. And so I'd be happy to take any of those now.
Yeah, okay, so I will jump in with just a few of the ones that we've had come through the chat. So the first one was, have you seen any pets with suspected cases of COVID-19, or have you heard any research or details about transmission to pets in the US?
Yeah, that's a great question. I kind of anticipated it, but I couldn't see a great way to kind of work it into what I was already planning to do. So thank you for that question. It's really good. So yes, we know that some animals, it seems, have been infected. The most kind of recent one, the tigers at the zoo, probably were infected by a zookeeper in New York. So yes, we know that animals do have the receptors for the coronavirus, specifically ferrets and cats. It seems like more so. I know there's one case of a dog that tested positive in Hong Kong. I don't know that it was ever like really, I don't know the exact details, like if they were verified that was why the dog had died or whatever. But so far we know that cats and some other species can apparently get infected. The good news is so far there's no evidence that then they infect people, which is, important. But I think with that in mind, knowing that they could if you were to get sick and you were worried that you had COVID symptoms, as much as that's the time that we want to like cuddle and be with our pet, I think it's a time to be careful and kind of minimize contact in case there is a chance that we could make them sick. But so far it seems that there's not been shown to spread from a pet to a person. And then when kind of as we're bringing pets in, there's not been real good evidence that pet fur, if a person was sick, we're being cautious with that about patients that come into the clinic asking about owners' clinical signs as well. But if, there's no evidence so far that pet, then the fur, if the virus was on the fur, would then transfer to a human being. So there's a lot more to kind of be figured out in that area, but so far that's kind of the main thing. And we're kind of keeping in mind, like our cats that come in with upper respiratory signs, possibly it could be that. So I think we're trying to take precautions and be thoughtful about that at this time. I still think likely things being more likely, probably some of the more common upper respiratory things and stress related for cats, since it's often a chronic herpes virus. And when I know I've seen a lot of cats for stress related things, because they probably want us to get out of their house if possible. They don't like this change in routine as much as they like us being here, I'm sure too. But yeah, good question.
So we just had someone else drop into the chat, and I'll just read this. Keep in mind that animals have their own strains of coronavirus as well, and we do not have one specific test for this particular strain. So evidence is questionable at best, some say. The CDC has stated that COVID-19 is a non-zoonotic disease as of right now.
Correct. So yep, it doesn't spread back to people. And yes, there are coronaviruses for dogs that cause diarrhea and for cats that cause other symptoms. So absolutely. Yeah, very good point. Thank you.
So this is a question on the vaccines. If we are skipping vaccines in adult pets for the time being, because we know immunity lasts a lot longer than the recommended 3 years, then why are some vets still doing them every 3 years or some even every year?
So that's a good question too. And our goal would be to still do them every 3 years. That's kind of where you're right. I think that some of the evidence shows they probably last, maybe 5-7 years in some pets, but we don't know which pets it's lasting that long. And some of the duration of immunity studies, the low end was more like 3 years, 4 years. And so we want to make sure that we're protecting those pets. And so it's just kind of hedging our bets, because there isn't like a good bedside test to kind of say this pet has immunity while that one doesn't, to kind of help us guide vaccines. And I'm sure the person that wrote that is aware of titer testing being available. So we draw blood and send that out. And that's like several $100s, sometimes $200 or $300 versus a $33 vaccination that is safe and effective. And I think as long as we're kind of minimizing the number of vaccines based on evidence, we're being judicious and cautious. And part of my rationale for not doing that vaccine for the pet that's been fully vaccinated for many years on that right away on that 3-year mark is we are supposed to be social distancing. And so your pet's hopefully not going to be getting exposed to pathogens that would be transmitted from dog to dog. But you're right. I mean, I think this is just one of those things that it'll continue to be revisited. And as for clinics that choose to do it annually, that's not how we do it. We follow the American Animal Hospital Association, all of our kind of the Association of Feline Practitioners. We try to kind of do things according to like what our kind of governing bodies and those groups that help, kind of make those decisions. So if your veterinarian is doing something different, I ask them. And if that doesn't feel comfortable, then, that's kind of up to you guys to figure out what to do next.
Okay, I usually get my dog's monthly NexGard and Interceptor from my vet, and I've just run out. What is the best way to obtain those? I'm not sure it's possible to get those directly from my vet still, and I don't currently have a prescription for either.
Yes, great question. And so I would reach out to your vet. Probably they're still filling prescriptions. Maybe have been some clinics that are fully closed, but for the most part, again, that extension of the veterinary client-patient relationship means that they should be able to fill medication for you up to 18 months from the last time you're seen. So if you're due for your annual exam, at least for us at our primary care, if you're due for your annual exam and it's now 12 months later, and normally we'd be doing all the boosters and the heartworm test, we are filling the preventative medications for 6 months. And the goal would be that hopefully things are at some point when this is lifted and all that, we'll be able to get you in, make sure that we aren't overlooking a broken tooth or some other thing that we need to help you with, or make sure that we're identifying for your pet. So I think while we all really want and stand by that, that interaction and that exam and all that stuff, getting your annual preventative medication, some clinics might choose to have you ordered online through Chewy or some other, brand, and no loyalty to them. Just it's one that a lot of our clients use. So, and then they fax us a prescription, we can sign off on it, and they can mail it. Some clinics, our pharmacy is mailing medications to clients to minimize contact in the clinic. So I think if you've seen your veterinarian in the past 18 months, they probably would have a way to get that for you. I think that's probably a pertinent question for a lot of people on here. So thanks for asking it.
Any ideas for nail trims for a dog who gets very anxious at the sight of clippers? Waiting for the groomer who has a gentle touch to reopen, but I did get a few nails done when he was in deep sleep before he woke up. By the time I get them all done, it might be time to start the entire process over again.
That's how it goes, and I've lived it. I have a dog who's totally like, oh my gosh, I'm like, I did all the things as a puppy with the yummy treats for handling, and then as soon as that trimmer comes out, she's just like, oh, it's happening. Like I've never taken a toe off, honestly, but I get it. It's really, some animals just are much more scared about those things. And so I think just like you did, I think it's not bad unless they start, like, you touch them in their sleep and they jump up and bolt off. I don't want it to become that, like they know what's coming if you touch their feet when they're resting. And so I would just have like a delicious treat ready when they're kind of resting, cut one nail. If they wake up, give them that treat, and then the next day do one again. And like, exactly like you said, by the time you get through all the nails, you're back to the first one again. And I think that's a way of kind of just like breaking it into small pieces so it's not overwhelming for you or for your pet. If that's the case too, you should contact your veterinarian, and they could maybe still get you a prescription for something that you could pick up that might help them be more comfortable. Kind of my go-to medication, and this is not like me giving you a specific recommendation for your pet, but I know for my own pets and for a lot of clients' pets, we're able to use a medication, trazodone, and it just, you give it to them beforehand, and it just kind of helps ease their anxiety and sedates them a little bit while it's being very safe. Some dogs, that's not even going to be enough because they're like, nope, that medicine, you're going to need more than that to cut my nails. So I know it's really, really challenging time. And I know your groomer wants to see you and your pet and help make sure that their nails are comfortable. So I think just doing your very best is all you can do.
Oh, I see Becky added a clarification. He was good for 10 years with nail trims, and now then it changed. So are those recommendations still the same?
Yeah, and maybe medication is even maybe more useful. Who knows what happened that one time, or if, I mean, I know for my own dog, she sort of tolerated it all along. And then at some point she was just like, I'm not going to do this anymore. Kind of like, all of us have those, like Allison at one point, again, like, oh, I'm over that. I don't need to put up with that from other people anymore, or I did it before. And so it could be that there was others, like minimal signs of anxiety, and they didn't love it, of course, ever. And then now something changed, or maybe a nail got clipped too short, which I've done. It just happens. So I think that the same recommendation, if you can just get, and actually maybe that would even, something delicious. I use Easy Cheese for my dogs when I do their nails. I'll squirt Easy Cheese on like a little plate, and then I'll set that down. They'll be licking the cheese. I'll do a couple nails, and then I call it good for the day. My son, he's 5 years old, and he says, Mom, can I have dog cheese? So he thinks Easy Cheese is dog cheese because we use it for nail trims. But yeah, so I think that's a good question. I think that still would be that'd be my approach regardless of age.
Awesome. What would be your recommendations to be a prepared pet owner during this time? Their question was, how do I prepare for the pandemic? How much should I be storing and saving for? What's unrealistic? What's realistic?
Very smart question. Yes, thank you for asking that. I kind of had a note to consider kind of adding that. So I think kind of the main thing I would say is just having, their food, having kitty litter if it's a cat, just like having like a month's worth on hand, medications, those kind of things. Again, knowing that our veterinary client-patient relationship has been extended for a while, maybe getting a little bit of a supply of medications and things like that so that you don't run out if this kind of keeps dragging out for a long time. So yeah, I think thank you for the pertinent question for sure.
Another question kind of related to the shelter in place piece. What is the best thing we can be doing with our pets? What's the best use of our time with our pets during shelter in place? We're getting this one-on-one contact that we don't normally have. So what opportunities do we have?
Yes, that's great. I train agility for my one dog, and now I don't have our weekly classes. And while I thought this is going to be time that I'll make sure and do training every single day, instead I've done the opposite. And every night I feel guilt, like I should be doing more. But I'm like, meanwhile, I'm just adjusting to this new normal, like all the rest of us. And so if you're stressed out and you're just not able to do it, just petting them is okay. That's what I tell myself every night anyway. But I think for like making that really thoughtful, intentional one-on-one time, if there is something that you've always kind of wanted to teach your dog, like let's just say to wave, you can go look on the internet and find ways to teach that like specific trick. I think dogs are so smart, and they kind of really feed off of like that individual one-on-one attention when they're using their brain to learn something new. So like choosing a trick that you've always thought would be interesting, going out on walks. If you have like a senior dog, just sniffing around the front yard. Like if you maybe don't normally take them on walks much anymore because of mobility issues or things, just sitting out in the front yard and letting them watch people go by while you're just sitting there relaxing with them and petting them. Or I have a neighbor has the fire hydrant, like kind of kitty corner, and I'll just take her over there and let her just sit. She's blind and 15, and she'll just sit and smell forever. Like it's the most interesting thing in the world. So I think letting your dog decide and you being really open to kind of seeing what they like. I'll sometimes do that with petting and stuff as well. Like, okay, so does she like it if I scratch under her chin? And if I stop and she's like, whatever, versus like, oh, hey, wait, I like that. Or, you know, things that I do that they hate, like when I just like pet their face and then they're like moving away as I'm doing it. So I think trying to kind of like read them a little bit better and kind of see what kind of things really interest them would be a great thing to kind of just tune into during this time.
Awesome. Kate M popped into the question and answer chat to share some experience that she has with the nail trim question. So she said, work on shake or simply touching the dog's paws multiple times a day. Some dogs really don't like their paws to be touched, so this can help desensitize them. Pet them with the clippers as well to desensitize. And then she has some recommendations of rescue remedy for pets and CBD are great to kind of help them relax enough to nail trims, and that works really well for some of her clients with those techniques. So she just wanted to share.
Yeah. And I think I'd add even pairing that, you know, touching the feet with something positive, like a food treat, instead of making it kind of neutral where you're touching, or maybe negative for some dogs, adding a food reward while you're touching so that that actually predicts something good is coming would be great. Yeah. Good.
Okay, is now a good time for a first-time pet owner to consider getting a puppy since they'll be at home and more present than they would be normally?
So that's a little bit challenging. I think I appreciate the first-time pet owner part, and I'd also say that every new pet, even with experience, brings a whole new situation. So nothing is super predictable. Like, oh, every puppy I've had has been amazing, and now I have this really challenging puppy. So it could even be true for anyone. The downside for adding a puppy, regardless, and maybe even more specifically to a newbie, someone that hasn't had a pet, is just lack of access to good resources. So usually we recommend starting a puppy class right away with a trainer, and then I know that I'm going to see your puppy every 3 to 4 weeks, but you're interacting with somebody in the meantime to help make sure that the house training is going okay, and the mouthing and all of the things that are just normal puppy behaviors, that you're getting the best information about how to manage those things and kind of prevent future problems and all that. So it would just be a little bit harder to kind of get good access to that information. Although, again, not to like plug any specific facility or anything. I know Possibilities is a facility that's based out of Orinoco, Minnesota, and they're all so training is like the Wild West. There's no specific credentials or anything, and so there are a lot of trainers that are using methods that veterinary behaviorists don't recommend. And I know that Possibilities, all of her trainers and herself included, they're all certified in sort of these like humane, effective training methods, and she and her group are doing online puppy classes. So if you were gonna do that, I think finding good resources so you had professionals that know how to answer those questions that are just inevitable, because I'd hate for you to be just like left all to your own without good information during that initial time. But I think I can get it. Like I can totally, and in fact, I kind of like start looking up pets and I'm like, no. I have 3 dogs and 2 cats. I think we're good. Now I don't need to add anything right now, but I told you, I admitted I'm not even training my puppy the way that I had hoped I would be during this. So, but I can really understand it. And it is a good time to get a puppy in that sense. Just a little challenging since they do require that you'll have to take them to the vet. And so that's interaction that you might not need. But if the puppies are on the ground, they need homes too. So there's a lot to consider.
Awesome. I'll give just a few more minutes in case someone has one last question to slip into chat, but I also want to make sure we're just about hitting that 45-minute mark, because I want to give us time to be done. Are there any kind of closing thoughts or last pieces that you haven't gotten to share yet, Kristi, that you'd like all of our lovely audience to know?
I did see one on the chat that just said, should I worry about my dogs developing separation anxiety from home?
Yeah.
They've been used to 7 to 8 hours of alone time. I think we covered it. I just wanted to make sure, just kind of like those little practice bits to kind of incorporate that throughout, hopefully will help us prevent separation anxiety in our pets.
Ooh,
if they're adults. Yeah, hopefully. Yeah. I think, it's possible that, that they will notice that change. So if you can give them that structured, quiet time alone, might just help prevent that when hopefully you're back to work for the normal 7 to 8 hours of alone time. parting messages, I guess just thank you to everybody for being here. I really appreciate you, your love of your pets and wanting to kind of consider these kind of things. And I think just recognizing again that we're all just doing our best, and we're so grateful for our pets during this time, as always.
Absolutely. So I will just give one last plug for upcoming webinars. This one was incredibly helpful and informative, and thank you, Kristi, for all that you did. And if you still have questions in the chat, drop them through. We'll make sure that we cover them before we actually end here. But so we have these webinars coming up next week and many others on a wide variety of topics. So check out umnalumni.org/virtual for those. And we also have pre-recordings on our YouTube page for the Alumni Association of all of the previous webinars that have happened. So there's a gold mine of information there if you want to go back through. And again, members make things like this possible. So we're thankful for any of you that are members. And now I want to make sure that we hit those last couple of questions that are coming through in chat. So Q&A. Oh, it's just people thanking you, Dr. Flynn. Oh. It was very helpful and everyone's enjoying it. So.
Oh, hi, Michelle. I know Stacy is. I know a few people. Thanks for joining us.
So that is all. Thank you all for joining us. And like we mentioned before, there will be an email that's going out after this is done. It will go out this afternoon, early evening because of the timing. That will have all the resources that Dr. Flynn mentioned, as well as a link to the video recording and the slides that happened today. And if you're watching a pre-recording of this on our website or on YouTube, there will be links down below in the description box to all of the resources that were mentioned. So you still will have access to those. And at any time, if you have questions or would like information about the Alumni Association, you can find us at umnalumni.org. Thank you all for coming and being part of it today. Have a great rest of your day.
Bye.